Thanks very much for having me. Thank you for introducing me. My name's Alicia. Disclaimer, I'm a nuclear medicine technologist, not a physicist, but I'm in charge of all research on our new total body PET scanner. And today I'm going to be talking about the first clinical trial that we did, which was called the Evaluation of Quality of Imaging on a Next Generation Total Body PET Scanner. And this, otherwise known as the EQUIP study, because it is a bit of a mouthful. So this study was set up to demonstrate that this novel system could produce images that either meet or exceed the quality standards for PET-CT imaging. So when we examined several system-level performance characteristics across a range of different radio traces, we concluded that our long axial field of view system provided superior image quality with, on average, an 83% reduction in scan time. And when image quality, sharpness, and lesion conspicuity and image noise were evaluated, our reviewing physicians consistently rated these images as excellent, and the number of lesions detected was increased, which really promises to result in significant clinical benefits. So back in November last year, the Peter MacCallum Cancer Centre installed the first long axial field of view PET scanner offered by GE Healthcare, known as the Omni 128. And one of the reasons for installing this system was the promise of greater sensitivity and system resolution that would enable faster scanning times to increase patient throughput and maximise patient comfort and experience. So we know the conventional short axial field of view cameras can only image up to about 30 centimetres at a time, and this limits photon detection and results in lower sensitivity, noisier images, and scan times upwards of 15 to 30 minutes. So one of the major drivers for this project was that the system specifications of the Omni 128 do deviate quite significantly from our other conventional short axial field of view cameras that we do have in the department already. Both conventional PET scanners utilise lutetium-based detector crystals that enable time of flight and use point spread function and OSEM image reconstruction protocols, whereas the Omni 128 utilises 30mm thick BGO crystals coupled to silicon photomultipliers, which does not enable time of flight measurements. But the trade-off here is the significant increase in stopping power and lack of intrinsic radioactivity, and these really combine to produce images with significantly greater sensitivity and much lower intrinsic noise. The system also offers an alternative to OSEM reconstruction known as Q-Clear, as well as precision deep learning, which is the manufacturer's method for replacing time of flight and ensuring optimal image contrast. So we wanted to ask the question, could this novel long axial field of view PET camera allow shorter acquisition times while maintaining or even improving on image quality? So to do this, we set up the EQUIP trial. It was an investigator-initiated project that utilised a prospective individual comparison protocol. It was a single-arm, single-centre study that was sponsored by the Peter MacCallum Cancer Centre. So a total of 25 oncology patients already referred to our centre for a diagnostic PET scan were prospectively recruited to undergo this dual PET-CT imaging protocol after a single radiotracer injection. So it's important to note that we did compare a number of system-level performance characteristics across a range of radiotracers to exclude any tracer-specific effects. So each patient was first scanned on our conventional short axial field of view PET scanner using standard acquisition protocols, followed immediately after by imaging on our long axial field of view camera using a 10-minute list mode acquisition. And for direct comparison, these long axial field of view PET data was rebinned to match the time per bed step used on the conventional PET system. And these images were then reconstructed using manufacturer-recommended algorithms to reflect real-world clinical performance. So analysis consisted of both qualitative and quantitative elements. We had 3 nuclear medicine physicians to help with analysis, where they were asked to visually perform analysis of the scans using a 5-point Likert scale. 3 domains were analysed, including overall diagnostic quality, sharpness and lesion conspicuity, as well as image noise. And we used the majority score of the 3 reviewers for each scan to then do comparisons between the systems. And note that statistical analysis was performed on these results to prove significance. Quantitative analysis was also performed on looking at image noise by calculating signal-to-noise ratios on a volume of the normal liver. So before I present the results, I just want to reiterate to everyone that we did rebin the long axial field of view images to match the time per bed step used on the short axial field of view PET camera. And when we compare the average time to image, we see there is an 83% reduction in imaging times. And this is really important that we take this into consideration when I present the following results. So analysis of the 3 blinded reviewer scores demonstrated that the long axial field of view system consistently achieved an excellent rating. And this was across all imaging domains analysed, and this was shown to be statistically significant. If we compare the number of scans that achieved a majority excellent score, we again see that the long axial field of view system was superior. And I just want to point out that none of the images acquired on the short axial field of view system ever achieved a majority excellent score. Image noise was assessed both subjectively using Likert scoring as well as quantitatively by comparing signal-to-noise ratios. Whilst the subjective measure did demonstrate an increase in quality with the long axial field of view camera, quantitatively there was no difference. But remember, these images were acquired on average 83% faster, so it does validate the use of BGO crystals for rapid scanning. So in 68% of patient images assessed, our reviewing doctors noted that the improved sharpness and lesion conspicuity enabled them to detect additional lesions that would have been missed if they had just looked at the conventional short axial field of view images. And importantly, this wasn't just observed for FDG, this was recorded across the whole range of traces analysed. This is just another example here where we see a number of small lung lesions that are clearly visible in the long axial field of view system but are absent in the short axial field of view images. So it just goes to demonstrate that increased sensitivity does result in improved lesion detection. So there were some limitations to the study. The cohort was relatively small, but this is pretty common for a detailed prospective method comparison. It's a single centre study, but at the time we were actually the first centre in the world to image humans. And the reconstruction parameters weren't matched, but this was deliberate to reflect real-world clinical performance. So in summary, the EQUIP study demonstrates that the long axial field of view PET camera did deliver on its promise to set a new standard for molecular imaging. It consistently produced superior image quality across all domains analysed and all radio traces tested, with an 83% reduction in scan time. And this is really going to improve workflow efficiencies, as well, importantly, improving patient comfort and experience. And the superior sensitivity has enabled more lesions to be detected, which should give doctors diagnostic confidence when they're reporting from these images. So I just wanted to thank all the participants who signed up to be involved on the trial, as well as my co-authors, and just a very quick plug for our prostic preceptorship that we're holding towards the end of this year in Melbourne. We've got some flyers if you want to learn some more information, and there's a QR code as well. So thanks a lot for listening.